like to introduce our next speaker. She is a practicing maternal-fetal medicine specialist at Duke, and she's here to talk about racial and ethnic disparities in healthcare. Help me welcome Sarahn Wheeler, Dr. Sarahn Wheeler.
Thank you so much for that warm introduction. I am thrilled to be here. There's nothing better than spending a beautiful Saturday with a beautiful crowd of people, all of whom love science. And I'm overjoyed to have an opportunity to talk about health disparities and issues that affect minority communities and some of our most vulnerable members of society that have very real consequences on their everyday lives. There are examples of health disparities throughout the medical field, and there are so many different examples that I could highlight for you today. But I'm a high-risk pregnancy doctor, and a large part of my practice is taking care of mothers who have a history of a prior preterm birth. And so I feel obligated to bring up the very clear and very stark disparities in preterm birth that have existed ever since these numbers have been recorded and persist even today. In the United States, about 1 in every 10 babies are born preterm. But when we look within the African American community, that number is 49% higher. These are babies that often spend weeks, months, even longer than that in the neonatal intensive care unit. These are babies that cannot go home with their families until a much prolonged time. These are babies that sometimes end up with lifelong health problems. And sadly, these are babies that we sometimes lose. These are mothers and fathers and families that are often changed forever. And it's oftentimes difficult to think about health disparities. It becomes overwhelming because there's so many different things that factor into these overwhelming problems. There are public health issues and social determinants of health, from poverty and education, healthcare policy, and even frank discrimination and racism. These are uncomfortable issues that no one likes talking about because they're not easy to solve and they're not easy to tackle. But I stand here before you today with so much hope. And I have hope because I firmly believe that science in many forms, science from laboratory science, science from political science, research science, community-engaged research, all of these are our most powerful tools to really understand these disparities and take steps forward to truly end these healthcare injustices that we see on a day-to-day basis. And so I applaud all of you for being here today as we fight for healthcare education, as we fight for research dollars, as we fight for legislators who use facts, data, and scientific evidence as we formulate policies that attack some of our very real problems, including healthcare disparities. And I know that as we today gather and we encourage the entire triangle to say that science is for everyone, I truly believe that we take a giant leap forward into being able to understand and tackle healthcare disparities and many of the real problems that plague not only us here in the Triangle, but throughout the entire United States. And so I thank you, and I ask you to join with us as we do this important work and fight together. Thank you so much.
Thank you, Dr. Sarahn Wheeler.